A unique opportunity that we afford to patients with urinary cancers, whether it be of the kidney or the bladder or the prostate, is the offering of clinical trials here at Washington University in St. Louis. So clinical trials, they oftentimes carry a negative stigma among the general population because people think that they're being experimented on. And people hear the word trial and they think that we're just trying out a medication and that we don't know what the outcome will be. It should be known that all of these types of clinical trials and studies are very strongly regulated at multiple levels to make sure that everything is safe for patients. And the way that I always tell my patients to look at it is not that they are being experimented on, rather they are in a situation where it is unknown what the best treatment is for their situation. And so if we don't know the answer and we don't know whether treatment X or treatment Y or treatment Z is the best approach for them, then the best way of answering that question and contributing to our knowledge base and for future patients is to have these medications or these treatments put up against treatments that we think would work in a similar manner. And so by that I mean, if you are on a clinical trial or being offered a clinical trial, it's generally comparing two treatments that we don't know which one would be more efficacious or more effective, but we think that both of them stand to give you a good opportunity, and enrolling in the clinical trial allows you to help answer that question, both for yourself but also for future patients. So we think it's a very important part of clinical practice, and it's something that you can't get at many institutions because enrolling in clinical trials is quite rigorous and requires a lot of work on the part of the physicians and a lot of infrastructure on the part of the health system. And so the ability to offer cutting-edge treatments to patients and treatments for difficult disease states, something that we pride ourselves on, and any time that we can enroll a patient, we generally try to do so if we think it's in their best interest.